Hello everybody, my name is Alex Hughes. I am the lead nurse practitioner here for the urology practice here at Austin Urology Institute. I want to give you your pre and post-op video for bladder Botox. So the reason you chose this procedure is you had some form of overactive bladder, whether that's frequency and urgency, where you're having to go to the bathroom all the time, but Botox is where you kind of landed, or you and the providers actually landed on you. So this is a procedure that's in the OR suite, so we do put you to sleep for this procedure. It takes 10 to 15 minutes long on the long end, but basically the bladder is a compartment, and it's supposed to just store urine and then empty urine. That's all it's supposed to do. But sometimes the nerves outside the bladder can become overactive. So it means it kind of fires all the time. A lot of times what I equate it to is AFib, so atrial fibrillation. So the top of the heart can kind of shake, and then it kind of makes your heart not pump correctly. The bladder can do the same things. So what we do is we go in with a cystoscope. So this is a camera that has a needle on the end of it. And we inject the bladder with very specific spots that we really want to target. So we go in through the urethra. So for males, through the penis. Females go through the urethra that's above the vagina. And then we go and inject certain points of the bladder with Botox. So basically that calms the muscle down. One of the most common complications is it works too well and then you can't use your bladder. And if that's the case, we'll put a catheter in you for about 24 hours and then usually my patients are urinating perfectly fine. Sometimes I will have my patients complain that they really have to kind of push to urinate for the first few days. That's super common. Burning on the urethra post-operatively is very common because we did have to go through the urethra to do the Botox. This procedure you do have to repeat every 9 to 12 months typically is what I see, but it's been really highly successful for our patients, and if you have any kind of questions, just feel free to reach out to us. Biggest things to watch out for is unable to urinate. That's a big one, and then any kind of signs of infection, so any kind of fevers, anything like that, please report it to us. Thank you.